The term arthritis is used loosely, as if it encompassed one entity, although over 100 types of arthritis have been identified. For millions of Americans, arthritis limits everyday movements such as walking, standing, or even holding a pencil. According to the National Institutes of Health, NIH, the effects of arthritis range from slight pain, stiffness, and swelling of the joints, to crippling and disabling discomfort. Arthritis affects people of all ages. The NIH reports that about 15% of the U.S. population has arthritis or a related disorder, and 200,000 children in the U.S. have some form of the disease. Rheumatoid arthritis is an inflammatory disease in which the body's immune system attacks its own healthy tissues. This is called an autoimmune response. The disorder affects many organs throughout the body, but is most noted for its significant disability, deformity, and inflammation of the joints and other structures comprised of connective tissue. RA can lead to crippling. It incapacitates the synovial tissue, which is the membrane that lines joints and secretes the lubricant that normally allows bones to move painlessly against other bones. With this condition, joints, most commonly the small joints of the hand, become tender, swollen, even deformed. Over time, the condition can also spread to other parts of the body. Symptoms of arthritis. Arthritis is an aggregate of illnesses whose common features include an inflammation of the joints, surrounding tendons, ligaments, and cartilage. Among the oldest known afflictions of human beings, it can affect virtually every part of the body, from the feet to the knees, back, shoulders, and fingers. There are 3 primary categories of arthritis, each with specific symptoms: osteoarthritis, rheumatoid arthritis, or gout. Night sweats, depression, lethargy, fatigue, low-grade fever, weakness, joint stiffness, and vague joint pain. These symptoms can lead to the appearance of painful, swollen joints within several weeks. RA may affect only one side of the body, but it is common for RA to strike the same joints on both sides of the body simultaneously, in the elbows, for instance. Later in the development of the disease, the affected joints become thicker and deformed. Types of arthritis. There are a variety of arthritic conditions, with the 3 most common forms of the disease being osteoarthritis, rheumatoid arthritis, and gout. Less prevalent types of arthritis include psoriatic arthritis, ankylosing spondylitis, and infectious arthritis. Young people may also suffer from juvenile arthritis. The onset of RA symptoms can be slow with mild discomfort in the joints, morning stiffness, low-grade fever systemically or in the affected joints, and a gradual increase of symptoms. Or RA can strike quickly, and people can develop the disease seemingly overnight. Arthritis is caused by a variety of factors, including joint instability, injuries, age-related changes, toxins, microbes, altered biochemistry, hormonal factors, and genetic predisposition. Yet other environmental, psychological, dietary, and even dental factors have also been found to bring on the condition. In recent years, research conducted by rheumatologists and allergists has concluded that some patients can experience allergy-induced arthritis. Stress can also be a major factor because it disrupts the body's hormonal balance. Stress-related changes in the chemical levels of cortisol can often lead to changes in the immune system. A weakened immune system allows certain bacteria to penetrate the body, possibly leading to forms of arthritis. This sequence often occurs in women undergoing menopause. Lyme disease can also cause arthritis symptoms, especially infectious arthritis. Presumably caused by bacteria, Borrelia burgdorferi, carried by deer ticks or black-legged ticks, the symptoms of Lyme disease may vary. Typical symptoms are a preliminary skin rash before the onset of fatigue, aches, and then flu-like symptoms. Eventually these bacteria penetrate the nervous system and attack brain tissue and spinal cells. The incubation period can be lengthy, with initial exposure commonly occurring during the summer, and most symptoms developing weeks or months later. Rheumatoid arthritis is classified as an autoimmune disease in which the body attacks its own tissues. in various combinations and severity: food allergies, nutritional deficiencies, toxicity, abnormal intestinal permeability, and microorganisms cause inflammation in the body. For someone who has rheumatoid arthritis, inflammation, the immune system's attack on foreign substances, amplifies and becomes a destructive autoimmune response. Delayed food allergies that disrupt the permeability of the intestinal walls can directly lead to onset of RA. This abnormal permeability allows incompletely digested food particles to pass through the walls of the digestive tract and into the bloodstream, where, if not cleared, they are eventually deposited in tissues. This can cause an inflammatory reaction, and the immune system begins to attack the tissues, especially around the joints. Many scientific studies have documented that there is increased intestinal permeability in over 90% of patients with autoimmune disease and arthritis. The top foods known to trigger rheumatoid symptoms include milk, yeast, both brewers and bakers, wheat, nightshade vegetables, tomatoes, eggplant, peppers, and potatoes, corn, and eggs. Other causes of rheumatoid arthritis include genetic susceptibility, lifestyle factors, nutritional factors, toxicity, and microorganisms. There may also be an association between rheumatoid arthritis and abnormal bowel function. These underlying causes work in various combinations to trigger inflammation in the body. Smoking and chronic exposure to secondhand smoke can also contribute to rheumatoid arthritis. Environmental medicine. Allergy and allergy-like sensitivities are often factors that contribute to the painful symptoms in arthritic patients. Theron G. Randolph, MD, and the founder of environmental medicine, discovered the link between arthritis and allergic reactions to environmental chemicals in foods. His research with over 1,000 arthritis patients found commonly eaten foods, especially nightshade vegetables, as well as chemical substances ranging from natural gas, auto exhaust, paints, perfume, and hairspray to insecticides, tobacco, and tobacco smoke, caused many of his patients' symptoms. Additional research has found that foods, chemicals, grasses, pollen, molds, and other airborne substances caused allergic reactions in the joints of nearly 85% of the arthritics in one study. Food additives, as well as foreign invaders like protozoa, bacteria, yeast, and fungus, can also trigger or aggravate arthritic symptoms. Diet plays an integral part in reducing or preventing the onset of all types of arthritic conditions. A diet that includes excess consumption of fatty meats, hydrogenated fats such as margarine or shortening, and conventionally produced dairy products generates highly acidic conditions in the blood. For healing to occur, these foods should be minimized if not eliminated from the diet. Caffeine, alcohol, tobacco, and all refined sugars should be eliminated. Replace processed sugars with alternative natural sweeteners or naturally sweet fruits. An occasional green tea is okay if caffeine is desired, and alcohol should be had in moderation, such as a glass of wine for special events only. Soft drinks are high in phosphoric acid, which can dangerously elevate phosphorus levels in the blood. The normal ratio of calcium to phosphorus in bones is approximately 2 to 1, although a 1-to-1 ratio is adequate to maintain skeletal growth. However, in the average American diet, this ratio is extremely skewed, with high amounts of phosphorus relative to calcium. This causes the body to pull calcium from the bones to supplement blood calcium levels, which can exacerbate arthritic conditions. An important step in treating arthritis lies in achieving normal body weight, as excess weight puts increased stress on weight-bearing joints affected with arthritis. A diet rich in an abundant selection of fresh vegetables and a wide variety of sweet and non-sweet fruits, nuts, and whole grains is recommended for maximum nutritional benefit. Whole, unprocessed foods are rich in the nutrients needed to fight destructive free radicals, promote skin and tissue health, repair bones, muscles, and tendons, and promote bowel regularity. Additionally, eating a whole foods diet will gently and slowly detoxify the system, ultimately leading to higher energy levels and inspiration to eat better, exercise, and follow through with necessary lifestyle changes on your road to health and healing. Supplements. Nutritional supplements. Many researchers believe a proper balance of vitamins and minerals is essential in the treatment of arthritis. The following have proved beneficial. Vitamin C. Large quantities of vitamin C are often recommended. Acting both as an antioxidant and anti-inflammatory agent, vitamin C helps repair and maintain healthy connective tissue. It is essential for collagen production and the maintenance of joint lining, helps tissue repair, and reduces the bruising and swelling often associated with arthritis. Vitamin A, vitamin B1, B6, niacinamide, vitamin B3, vitamin A, vitamin D has been shown to be a key factor in aiding arthritis. If you like this video, please click the like button, leave a comment, and subscribe to the channel. Thanks for watching.